I'd like to talk about some of the different things I have learned to deal with over the course of having had 5 babies here at CloudMom. And one of the things I have had a fair amount of experience with is something called mastitis. This is a pretty important and significant health issue, so I did look this up because I want to get this all right for you guys. According to the American Academy of Pediatrics, mastitis is an infection of the breast tissue that is caused by bacteria. It can result in nausea, fever, and pain, as well as redness and extreme soreness in the breast area. Now, this can be caused by skipping a feeding or by your baby's changing the way in which he or she feeds, or it can be caused by your body having low immunity, and it can be something that just hits you by storm. I actually had this recently and was out with my husband. I felt so nauseous. He was freaking out that we were pregnant with our 6th child. So you don't often yourself even quite know what you have, but you find that you feel nauseous, you feel sick, you feel really tired, and then that one of your breasts really, really hurts and is red and sore. So the question is, what do you do when you get mastitis? Okay? According to the American Academy of Pediatrics, and you have to check with your doctor, it is still safe to nurse. You can safely nurse through having mastitis. If you feel that it's too painful to nurse, often actually the good thing to do is to express or pump out a little bit of milk because you want to keep nursing. The solution to mastitis is not to stop nursing, okay? And according to the AAP, it's safe for the baby to consume the breast milk that you produce while you have mastitis, either through nursing or through pumping. If it seems that you have an extreme case of mastitis, in all likelihood, your doctor will prescribe for you an antibiotic. And this should be an antibiotic that you can take and still safely nurse your baby, okay? So go over all this with your doctor, but that is the theory. Now, in terms of the symptoms that you have, a really good thing to do is to get into the shower, have a nice warm shower, and just sort of open it up and let the water beat down onto your sore breast or breasts. Massage the area that feels as if it's gotten blocked. That can really, really help. Another very good thing that you have to keep in mind is rest. You just might be totally overloaded. You might be completely exhausted. And this might be a good indication that you just need to slow down. You need to hang out a little bit with your baby at home, breastfeed your baby, do a little bit of pumping, concentrate on your baby, concentrate on your own breasts, slow down, and take care of yourself. Fluids are also mentioned as something that's important. Make sure you get enough healthy fluids, water, juice, herbal teas, all that good stuff that your body needs. Make sure you're replenishing yourself because you're really doing a lot and giving all these nutrients to your young little baby. Anyway, I've had this many times. Again, it is one of these things that you can learn how to deal with and that you can continue to nurse through. And keep in mind, if you are on antibiotics, you might be shocked by how quickly they work. I had these administered to me once when I was in the airport. I was feeling so sick, and by the time I was on the plane, I already felt better. So they can work very, very quickly, and actually mastitis, as quickly as it comes on, it can go away. So hang in there. Make sure you go to your doctor, get his thoughts on what to do, follow these little pieces of advice, and I promise that you will be feeling better soon and comfortably back to nursing your baby.